So we're going to start with Captain Noe for her 5-minute introduction or opening remarks.
Great, thank you. So good afternoon. Thank you for this opportunity to present CDC's ongoing activities to provide expert guidance and support to improve disaster-related mortality reporting at the state and local level. Please note, I will not be speaking on the use of morbidity data for near real-time surveillance because these are typically syndromic data sources, which is out of scope of this study. CDC published research that identified underreporting of disaster-related deaths on death certificates after several recent natural disasters. Missing from the certificates were any reference of the natural disaster, which leads to challenges in disaster analysis when conducting surveillance, adjudicating the official number of deaths, and determining eligibility for federal disaster funeral assistance. There are 3 potential reasons that certificates are missing any reference, and they're because medical certifiers, usually medical examiners and coroners, one, they could be underappreciating the importance of including the incident or details or terms on the certificate. Number 2, it could be they use a different case definition or criteria to attribute the death of death to a disaster. And 3, they may lack sufficient scene investigation information to attribute the death to the disaster. So to address these challenges, CDC has done several activities. We first have evaluated the utility of a disaster-specific alert or a flag in state-based electronic death registration systems to use as a real-time reminder or educator of the importance of including the disaster term on the certificate. We've also developed a disaster-related death certificate completion reference guide, which you have in your packet, and that gives case definitions and a framework. We've also developed a disaster-related death scene investigation toolkit, which you also have. And finally, we've taken all these tools and we've updated these into the CDC Public Health Preparedness Response capabilities and also the cooperative agreement. The FEP, or the Public Health Emergency Cooperative Agreement, funds 62 state, local, and territory health departments to increase public health emergency preparedness and response capability. So effective fatality management during an incident requires response from multiple sectors, most notably the medical examiner and coroner system. The medical examiner coroner's duties include respectful and orderly management of deceased persons, but sharing the mortality data in a timely fashion. Professional associations such as the National Association of Medical Examiners and also state-based plans have fatality management templates and protocols, yet many of these do not provide specific guidance on what data points to collect or should be collected that would be important to share with emergency management and health departments for public health action. This lack of clarity can introduce confusion on what, on who, and how data should be reported. As previously mentioned, CDC included these tools into our CDC 15 public health preparedness capabilities, and we've included this especially in the fatality management one. The new content encourages states to use the tools, leverage electronic reporting, and increase engagement with vital records departments and FEMA. We highlight these 2 partners because they are critical in adjudicating the final official numbers of deaths and ensuring that eligible families receive funeral benefits in a timely fashion. In addition, we highlight the importance of building or strengthening electronic reporting capacity, including this interoperability of medical examiner coroners' case management systems and electronic death registration systems. Yet, despite all these activities I've presented here, there are some anecdotal evidence that these guidance and tools are not being considered or adopted into state and local response plans. And vital records and public health preparedness programs have limited engagement in supporting these. There is a need to increase coordination of tracking and recording deaths after disasters among many stakeholders, and we'll talk about this on this panel, all the different stakeholders. And it is important for state-based preparedness planners to bring these stakeholders together to review the disaster-related reporting processes and encourage the inclusion of these tools to improve efforts to track deaths in their jurisdictions after disaster. Well, in summary, CDC recognizes to improve the accuracy and timeliness of disaster-related mortality reporting, we really need to do three things. We have to build capacity among medical examiners and coroners and vital records as they are the data providers. The leveraging the FEP funds or other CDC cooperative agreements or other HHS cooperative agreements to strengthen electronic mortality reporting. And we need to promote increased engagement and coordination between vital records, public health preparedness, and our epidemiologic programs at the state and local level. This concludes my opening remarks. Thank you.